At the heart of this issue is non-disclosure. I have the HSE's non-disclosure policy document here. And, I beg your pardon?
It's the disclosure policy, not the non-disclosure policy.
The disclosure policy. I'd like to, the open disclosure policy, thank you. I'd like to read out what the HSE defines as open disclosure, which is at the heart of all of this. An open, consistent approach to communicating with service users where things go wrong in healthcare. This includes expressing regret for what has happened, keeping the service user informed, providing feedback on investigations, and the steps taken to prevent a recurrence of the adverse event. So the question at hand is whether Vicky Phelan was afforded open disclosure, and whether many other women and possibly men within the National Screening Service have been afforded open disclosure, and indeed there is a wider question now across the HSE due to this. From what I've seen over the last week, there is a conspiracy of silence within the healthcare system when it came to Vicky Phelan's case and when it came to several hundred other women who were not informed of false negatives. The National Screening Service, senior people within the National Screening Service knew about the details of Vicky Phelan's case, and they knew that hundreds of other women had not been communicated with. Senior management within the HSE knew these things as well, and the doctors knew these things. Maybe not in the hundreds, but the doctors knew that their own patients had not been communicated with. So at the very highest levels within the HSE, at the level of direct reporting to you, Mr. O'Brien, at a senior level within the National Screening Service, and senior consultants all knew for years that these false negatives had occurred. And as of today, all of the women still have not been told. So, Mr. Henry, or Dr. Henry, can I start with you? We know that you were made aware of this issue, not just Vicky Phelan's case, but the wider issue of women not being afforded open disclosure. Why did you not inform Mr. O'Brien as the head of the HSE, and why did you not act to begin to put in place the measures which are now being put in place in an emergency response because this has gone public? Why, when you were told about this, did you not act to ensure that all of these women were afforded open disclosure, as is clearly required under HSE policy?
Thank you. Well, in my then role as clinical advisor, which I was working at then, I was informed by the clinical director of a hospital group of his concerns over who was responsible for disclosure of this information. So I immediately consulted with the Women and Infants Health Programme and contacted the medical director of cervical screen asking her opinion and her response to the concerns raised by the clinical director in the hospital group. The reply I received was that the opinion was from the cervical screening programme was there was a responsibility of the caring clinicians to provide this information. There was an exchange of correspondence between me following meetings and advice I received from other relevant clinical leads, which culminated in a meeting between the lead colposcopists, that's the clinicians, and the medical director of the screening programme on September the 1st, just 3 months. The first correspondence I received was July the 11th, so September the 1st was the day of the meeting. I received a correspondence the following week from the medical director's screening programme saying that they had changed their policy regarding communication and that there was further meetings planned with the colposcopists, so there would be consensus as to how they were going to communicate with patients, who was going to take responsibility and when this would happen.
Okay, maybe you were trying to answer the question. I didn't hear an answer. My question, Dr. Henry, is this, right? You were made aware of a very, very serious breach of open disclosure. It would appear that when you were made aware, actions were not taken to ensure that these women were informed. Why?
At that time, Deputy, I was working as a clinical advisor, and what I did was I engaged with the people, including the medical director of cervical screen and the hospital group and clinical directors and relevant clinical leads, to facilitate a discussion that would lead towards that. That was the role I played there, and I received assurances subsequently that meeting had taken place and that the communication policy had changed, and they were in agreement as to how communication would take place.
Did you not think the seriousness of it, as evidenced by national public anger and fear, did you not think that the seriousness of it warranted escalation to Mr. O'Brien?
In the first instance, rather than escalating a problem that sorted me, Deputy, I'd like to think I tried to engage directly with the problem myself, which is exactly what I did. I consulted with the relevant clinical leads, the clinical director of the hospital group, the clinician concerned, the medical director of cervical screening on a number of occasions, and had a number of meetings which led to them dealing directly with the clinicians, after which I was told that a consensus had been achieved.
Do you believe, therefore, we now know that no action occurred. We now know that 3 in 4 women were not told. We know there were open disputes which you were brought into between a clinician and the service. Do you believe you've just stated to the committee that, as far as you're concerned, you initiated the process, you took the appropriate action, and you were led to believe that things were happening? Do you, at this point, knowing what we now know, believe you were misinformed by other parts of the HSE? If you were led to believe things were happening which clearly weren't happening?
Knowing what I know now, clearly the most important part of all this engagement and all this communication was that women would be told. Yes, of course.
Yes, of course you believe you were misled.
I wouldn't go, well, clearly it hadn't closed the way it should have been. It was only closed the moment women were told, and that didn't happen.
Thank you. Mr. Gleeson, could I come to you? You made a decision, or I beg your pardon, you stated earlier on that, quote, there was never a decision not to disclose. Specifically in the,
not to my knowledge,
in the case of Vicky Phelan and the others.
That was in relation to the cervical check programme. That was never
to cervical
that was
check.
The question I was asked.
Can I want to challenge that statement for several reasons. We have a circular from cervical check saying to doctors, in incidences where the woman is still alive, use your judgment, and in incidences where the woman is deceased, just note it on the file. The other thing we have is a letter from the ex-clinical director, Dr. Flannelly, I beg your pardon, from Dr. Hickey, Vicky Hayes' consultant, to cervical check, stating the following. Dear Grania, on further reviewing the letter that you sent down to us with respect to an audit of the cervical smears on cancer patients, you highlighted just 3, Dr. Hickey had 10 patients, you highlighted just 3 that you felt should be considered for recall on discussion. There are a number of others that look as though there are significant discrepancies, and we are somewhat uncomfortable about just recalling the 3 that you have highlighted. So there is an active correspondence from a consultant saying, I have 10 women that this affects. You've told me they all need to inform and use my discretion. But clearly he was being told by cervical check that only 3 of the 10 needed to be told. Now, given that and given what was in the circular, do you stand over the statement that there was never a decision not to disclose? And if so, how?
The decision, the 10 cases that you're referring to, so the process was under discussion between 2 senior clinical people, consultant doctors, about how to disclose. We had already sent the information to the receiving clinician. There is an assumption that the other 9 cases were identical to the one that has appeared in court. I doubt if any 2 cases are the same. So I think caution should be exercised, but I'm certainly not revealing the details of them. Okay? The engagement is we had disclosed. We had sent it on and asked it to go further. The commentary around that, and I won't speak for Dr. Flannelly, but she's here yet, was this consultant sought assistance in reviewing patient notes. They did it together. It's nothing to do with it's clinical. On who should immediately be told of something like that. You don't know whether one of those reviews changed anything or not.
We will move on.
It's the same, but clearly. They did identify for specifically that case, please review.
Mr. Goosen,
and it did happen.
We have documentary evidence showing that the active advice from cervical check was to tell just 3 in 10 patients. Okay, and I don't need a response, but my view is that that is a decision not to disclose. Mr. O'Brien, can I come to you if I may? In 2013, the open disclosure policy came into place. In 2014, there was an audit. In 2015, a decision was taken to share the results with the women, so 2 years after open disclosure came in. In 2016, the information was actually shared with the doctors. In 2017, Vicky Phelan found her information. Given all of that, do you believe that the HSC has failed in its duty of open disclosure and failed in its duty to these 208 women?
Yes, I do.
Thank you. How did so many people in the HSC, including clinicians and managers, stay quiet in what was clearly an egregious breach of open disclosure?
I don't know that they stayed quiet, because there does seem to have been quite some discussion and debate which appears to have been intended to bring the matter to resolution. I said in response to a question earlier, and I think you may have been out of the room, that at an earlier stage it would have been appropriate for someone to put their hand up and say this process is taking too long. The fact that there's an ongoing discussion about how to do it rather than doing it needs more significant intervention, and should have escalated it, if necessary, all the way to myself, though I would hope it wouldn't have had to get that far. But the fact that that escalation didn't occur is a source of concern.
Thank you.
I used the phrase that they seem to have been trying to find a perfect solution. What they should have just done is found a solution.
I was here for that. Thank you. The principles of open disclosure from the HSC, I'll read them out very quickly. Acknowledgement, truthfulness, timeliness and clarity of communication, apology, expression of regret, recognising the expectation of service users that they may reasonably expect to be fully informed of the facts and consequences in relation to an adverse event, clinical governance. Do you believe that the case of Vicky Phelan and now the subsequent cases constitutes a failure of clinical governance and managerial governance within the HSC?
Yes, clearly it does.
Thank you.